Good afternoon, everyone, and thank you for joining us today. My name is Denise Keel, and I'm the Executive Director of the Michigan Climate Action Network. I will serve as the moderator of today's press conference and will take questions at the end from the media. Climate change is already hitting Michigan hard. In order to keep moving climate progress forward, we must push back on the kinds of threats we have seen in the last few days, specifically those to take away the benefits of the Inflation Reduction Act, or as it's known, the IRA. In its first days in office, the new administration has already attempted to freeze funding, throwing tens of billions of dollars of lawfully designated clean energy funding under both the IRA and the bipartisan infrastructure law into uncertainty. These are two incredibly popular pieces of legislation that have the potential to provide numerous benefits to Michiganders' health, economy, and environment. Michigan stands to lose a lot from these attacks. Our state has been the top beneficiary of IRA funds, with 74 projects totaling $27.8 billion, creating 26,352 new clean energy jobs. These funds and the benefits they provide are under direct threat. Moreover, it's clear that Michiganders don't want these programs to be rolled back. For more than a decade, polls have consistently shown a majority of Michiganders are worried about climate impacts and support more action. In partnership with the Climate Action Campaign, we'll be unveiling 3 petitions with strong support for climate action in Michigan. Our Stand Strong for Climate petition is signed by more than 14,000 Michiganders. Another is endorsed by 39 Michigan-based organizations, and 89 Michigan leaders have signed a third. These polls and petitions and our efforts in communities across the state show that Michiganders are standing firmly behind climate and health policies and are against the attacks on the IRA. That's because rolling back the Inflation Reduction Act not only goes against the public will of Michiganders, it will hurt our friends and neighbors' pocketbooks and contribute to rising energy costs. The IRA provides $9 billion in consumer home energy rebate programs to help us switch to cheaper, cleaner energy. These provisions would lower Michigan residents' energy bills by more than $1,000 a year. Along with its home energy rebate programs, the IRA invests another $1.5 billion in urban tree planting programs to combat heat islands in cities like Detroit and provides electric school buses to Michigan students. It's also going to profoundly affect Michiganders' health. We've got a couple amazing speakers with us here today who are immensely qualified to talk more about these health impacts and the harm that these potential losses of funding would cause. First, I'd like to introduce Jada Robinson. Jada formerly served as the Climate Health Equity Director at Michigan Clinicians for Climate Action and is currently an intern with Eastside Community Network as she completes her Master in Public Health from the University of Michigan.
Thank you, Denise. Good afternoon, everyone. Thank you to all of the organizations for collaborating to host this important event and for inviting me to speak today. As a public health scientist and activist, I have dedicated my career to advocating for the health and well-being of individuals and communities. However, in my short lifetime, I have seen firsthand how the environment we live in profoundly affects our health, especially here in Michigan, where air quality, clean water, and access to safe, sustainable infrastructure can mean the difference between thriving families and chronic illness. The Inflation Reduction Act and the Infrastructure Investment and Jobs Act represent historic opportunities for our state. Michigan stands to benefit from over $26 billion in IRA-funded projects. These investments are not just numbers on a balance sheet. They are lifelines for Michiganders. Clean energy initiatives, transportation modernization, and health-focused infrastructure improvements will reduce pollution, create high-quality jobs, and promote healthier communities for generations to come. But now, these investments in the future they promised are at risk. Proposed rollbacks threaten to derail the progress we've made, jeopardizing the health and well-being of every Michigander. Let me just give one example. We know that poor air quality worsened by reliance on fossil fuels increases the rates of asthma and cardiovascular diseases. These conditions disproportionately affect low-income families and communities of colors, my apologies, who are already burdened by health inequities. By transitioning to clean energy and expanding access to public transportation, the IRA and IIJA address these disparities head on. This is not only a matter of environmental justice, it's a matter of health equity and moral responsibility. Preserving these policies also means preserving economic opportunities. Michigan's leadership in the clean energy sector has already created tens of thousands of jobs, and the IRA ensures this momentum continues. Supporting renewable energy and electric vehicle manufacturing doesn't just boost our economy, it positions Michigan as a national leader in the fight for climate change. Every decision we make about these policies impacts real people, ourselves, our neighborhoods, and our loved ones. That's why I'm here today to lend my voice as a public health professional, standing up for the future we all deserve. Together, we must demand our leaders to uphold the IRA and IIJA. We must remind them that these policies are more than just legislation, they are promises to our children, our communities, and our planet. Thank you, and let's continue this critical work to protect Michigan's future. Now, I will introduce Lisa Del Bono, a retired physician and the founder of MICA.
Wow, thank you so much, Jada. Excellent. You know, today we are talking about climate legislation passed during the last administration, especially the IRA and the IIJA, which has been mentioned. That legislation has spurred the economy in Michigan, and it's created real jobs for real people. But what has it meant to the average person in terms of health and well-being? Well, as a retired doc, I can tell you that this legislation is, without a doubt, essential to protecting the health of all Michigan residents and our children's future. You see, climate change is making people who live in Michigan sick today, and Michigan health professionals are seeing the impacts of fossil fuel pollution every single day in their offices and clinics. Most major health and medical societies agree that climate change is the biggest health threat facing us today, but it also provides a huge health opportunity, which will only be realized if we protect the important incentives embedded in the IRA and the IIJA. For example, the IRA has provided Michigan with incentives that have led to billions of dollars of investment in new solar, wind, and battery storage projects right here in Michigan. Projects that are not only critical to the healthy, clean energy future that protects our children, but they will also support access to affordable and reliable electricity for all people. If you ask any first responder, they will tell you that when the power goes out, the emergency department braces for an influx of patients who rely on that electricity to keep life-saving medical devices working. One ER nurse who works in Detroit recounted a winter power outage, which overwhelmed the ER with patients suffering from carbon monoxide poisoning while trying to stay warm using generators and grills inside. And as she described it, the flood of carbon monoxide patients added an entirely new level of chaos to the emergency room. She said protecting climate legislation isn't just about the environment. It's about safeguarding lives and preventing crises like the one she lived through in the ER that winter. Now, the IRA has also already allowed millions of American families to upgrade their homes and save money while doing that. That will not only reduce heat trapping emissions and address climate change, but it will also ensure a more safe, comfortable home during extreme weather conditions. It also means switching to electric appliances that will avoid toxic emissions from things like gas stoves, which are responsible for approximately 13% of pediatric asthma cases, and which produces levels of benzene, a known carcinogen, that are higher than one would experience if they breathed secondhand cigarette smoke. Finally, this climate legislation has provided incentives that develop the infrastructure for electric vehicles and, importantly, also electric school buses, which is really a good thing when you think about the fact that the asthma rate for Michigan children is 18% higher than the US average. Most of our current school buses run on diesel fuel, which produces a toxic mix of gases, which aggravates asthma and interferes with children's ability to learn. One study estimated that if we transition to clean school buses across the country, it would result in 14 million fewer absences per year. Right now, we are truly standing at an inflection point. As a healthcare provider, the choice is obvious. Let's not continue to risk the health of those we love, especially our children, because of divisive partisan politics fueled by corporate misinformation that advances an antiquated and polluting fossil fuel industry. Instead, let's protect the funds already promised to Michigan in this federal legislation to ensure that all Michigan residents have the freedom to breathe clean air, the freedom to drink clean water, and the freedom to live in a healthy environment. Thanks. I'll pass it over to Denise.
Thank you so much, Dr. Del Bono and Jada, for those wonderful remarks and really thinking about the health of our communities. Again, 73% of Michigan residents support increasing the share of electricity that is produced from wind, solar, and other clean energy sources. And it's for good reason that these initiatives like the IRA and bipartisan infrastructure are so popular, because the data is clear. Rolling back climate policies would be a bad deal for Michigan. These funds and resources not only serve to protect our climate, but our public health, as you have just heard, and our jobs and lower energy bills for hardworking families. It is imperative now more than ever that we ask our Michigan leaders to defend these investments from any further attacks and make a public commitment to stand strong for climate in the years ahead. I want to thank everyone who is here today. Special thank you to our speakers, and thanks to the Climate Action Campaign for hosting this call today, and our partners who helped pull it together: Environmental Defense Fund Action, Moms Clean Air Force, and Michigan's Clinician for Climate Action. I'd like to open the floor. If there are any brief questions, we can take a little time to take those. Raise your hand, announce your name and publication, please. If there are no other questions and comments from our panelists, again, really thank everyone for their comments today. Dr. Del Bono, Jada, thank you all, the Climate Action Campaign. We can reach any of us through the Climate Action Campaign or our organizations if there are further questions as we continue to stand strong for climate. Thank you very much.